Hello friends, today we'll discuss about how to identify and treat a failed fistula. Now, to identify a failed fistula, simply try to feel the thrill. If you don't feel the thrill or the pulse in the fistula, means it has clotted or it is completely failed. Now, clotting means it can involve the artery or the vein alone. Now, how to treat it? The most important is the time. If you get your failed fistula treated early, there are high chances that it can be saved. So if you get to know that your fistula is failed today, please visit your vascular surgeon today to save it. So what will a vascular surgeon do, or how do they treat this? Now there are the components of this treatment is: 1, to remove the clot from the fistula, and 2, to treat what has caused this fistula. Now, removing the clot can be done by either an open method or through an endovascular or percutaneous method. In the open method, we cut open the fistula, remove the entire clot and then suture it back. In the percutaneous, we try to thrombolyze or dissolve this clot through a small puncture and treat it, the fistula. So, now the main part, which is to treat the underlying lesion, is to treat what has caused it. The most common cause is a narrowing of the vein somewhere either near the anastomosis, between the puncture site, or somewhere higher up. Now this can be treated through a balloon angioplasty or by a hybrid procedure in which we open and repair it with a patch, as well as doing a balloon angioplasty if there are any other lesions. So open patchplasty or fistuloplasty are the treatment for treating the underlying lesion. Now, if you identify a failing fistula early, in which the thrill is there but it has decreased or increased, then the fistula can clot anytime. So in a failing fistula, get it treated early with just a balloon angioplasty before the clot forms. Take care. Thank you.